Welcome back to the weekly news roundup. We are talking today, once again, we are returning to the dystopian edition because holy crap has the world gone mad with COVID. And I'm not sure it's justified. And we're going to talk about why that is, and we're actually going to look at real data. And we're going to look at some of the crazy stuff that is going down around the world right now. And it's kind of scary. Now, an article just came out, or it was all across the country, contracts and compacts are being made with students going to school. There's one, I believe it was in Texas, where the parents have to sign a document saying that they will not listen in on the instruction when the teachers are teaching your children. Homeschool your kids. Because also a couple weeks ago, there was a discussion where a guy's saying, he's a teacher in Philadelphia, and he was saying, you know what? We have a hard time teaching our kids about the LGBT stuff and other things like that when the parents are possibly in the room because parents are dangerous. That's a problem. We're going to go ahead and have a look at data. Real data. We're going to start with this article from Newsweek. This is from Newsweek. Sweden, I'm going to have to use code words on this because some of these are like bannable words. So we're going to say Swiss cheese and the coof, and I don't know what we're going to say for that, rates. So in Swiss cheese, the coof rates are lower than Spain, Italy, UK, I believe even the US. So of course this is like, they're gonna kill everybody, they're so stupid, because these were the people, they weren't doing any masks, they weren't doing any forced lockdowns. They said, hey, there's a virus running around, it seems to hurt older people, you guys take whatever precautions. We're basically saying, hey, keeping a little bit of distance might not be a bad thing, but they put no other restrictions. This is what is called in science a control group. Okay? This is a control group. It's the only control group in the world. By the way, Stockholm, their capital, has a population density twice that of New York City. As of August 12th, so we are only a couple days ago, the rate in Swiss cheese for the coof. Now everything is reported in deaths per 100,000 across the world. It was 56.66. UK, which went under one of the most extreme lockdowns, had 70. Spain, 61. Italy, 58. Average rates, Belgium has the highest in Europe, 86. No lockdowns, no masks. Here is the numbers. Belgium, UK, Spain, Italy, they are down here, halfway down. Now the other countries here, a little bit lower populations. Some of these went a little bit crazier than others, but you can see that it's right in the average mix, indicating all of this kind of stuff is probably a little bit crazy. Now, this is neat. They're trying to push this one here. This is rolling average of newly confirmed cases. We're going to cover why this is. It actually turns out that the United States is doing about 10 to 15 times more tests for this disease. It is so dangerous, you have to get tested if you even know you have it. Again, more tests. When you have more tests, you have higher numbers. These are not rates, these are total cases. So this is all part of the propaganda that says, the United States is doing worse. No, we're actually testing more. Confirmed cases, meaningless numbers, by the way. We're going to get into why that is. In fact, we're going to get into this right now. Now, I am going to focus on data from my state. And we're going to look at several news articles from my town because this stuff is creeping in. And we want to ask, where is your line? At what point in time are you going to stop? All right. Because I want to look at my data so that I can hopefully encourage you to go into your towns, into your cities, and look at your data. I want you to see what your cities are doing. I very well may be guilty of waiting until it's a little bit too late. I don't know. Now, I'm not in the city center. I'm in the last township that said, no, we're not really putting anything special into play. So I'm safe right here. But every other township surrounding me, you can't have friends over. You have to wear a mask even outside in a park. You can't go through a drive-through without a mask. We're going to get into all this. But this is the data from my health department. So this is not Alex Jones' right-wing wingnut. This isn't some crazy guy. This is the health data as of right now from the Pennsylvania Department of Health. Okay, Pennsylvania Department of Health. Last updated today, 12 p.m. Data for Pennsylvania. Total cases. Now, I believe Pennsylvania, I forgot to look this up. I think Pennsylvania has 5 million people in the state. We have 127,000 cases, 1.3 million negatives, and right now they're saying 80% are recovered. That means of all this number, we have a grand total of 20, I think that'd be about 25,000 active cases out of 5 million people in the state. Here is daily cases. This is the peak in April 9th is where we peaked. This upswing is when mask laws went into effect. Reopening happened here. This is reopening. Continue to go down. This is mask laws went into place. Started to go up. And it peaked again July 23rd, and it's been going down. This is your daily tests. This is why the United States looks like it's a horrible thing. Because our tests are rising, still rising with a linear curve. 26,000 tests on August 14th. And you're wondering why the cases are skyrocketing. They're not. This is real data. Now, we actually drill down a little bit further. This is interesting here in the entire state. This is new cases per day. Again, here's your peak. We're still on a downward trend. Deaths by day. Dude, we've dropped to like nothing. Nada. Nothing. Daily PCR tests. And notice, by the way, this is from the very beginning to now. Just this week. Just this week. You put a small scale like this so you can't see how exponentially it is. If this went back all the way, it would be microscopic down here and huge up here. Because our tests are going up. All right. Cases per day. Once again, a little bit bigger. There's nothing even registering. Cumulative cases. Now, cumulative cases means they never go down. Cumulative deaths is a flat line. We've had 15 deaths today. More people have died of heart attacks across the state today than have died of anything else. Of course, it's all called COVID deaths, but zip codes, we're not going to look at that. Hospital preparedness. Okay, by the way, we're on day, I think, 157 of the 15 days to slow the spread. In the entire state of Pennsylvania, with 5 million people, we have 510 people hospitalized with COVID. Our county, where they just instituted mask laws, they are now walking around issuing fines. We have to wear a mask to go to the drive-thru. We have not seen a hospitalization since May. May. The state tells us we have 11 deaths. Our local county only knows of 7 deaths. Nobody knows where these other, 5 deaths are. 5, 6 deaths are. Nobody knows where they are. The 7 deaths we have an age range of 76 to 94 years of age. Day 107 of the 15-day to slow the spread. Where are we at? Well, we have over 1,100 hospital beds just in the ICU. We have 4,000 medical surgical beds. We have 45 ICU pediatrics, 333 pediatrics, and we have 1,126 airborne illness, and we have a grand total of 510 COVID patients. There are 93 patients on a ventilator. By the way, Pittsburgh alone can support 1,000 ventilators. Our local hospital, which is fairly small, can support 40. Number of ICU beds with beds available, really high. Now you can see they're going down. Why is this? Because they're getting rid of the ICU beds and allowing people to come back in for elective surgeries. That's why that's going down. Curve of people on ventilators, it's still going down. I want to look at death demographics. This is the race demographics and stuff. I'm not really interested in that. Male to female, it's about 50-50, slightly higher on the females. Definitely non-Hispanic versus Hispanic, but we don't have a lot of huge Hispanic populations in Pennsylvania. Death by race. BLM should be out there absolutely loving this because it's just killing the whites. Age distribution. We have exactly one death in the 20 to 29 age range. He was not a healthy person. Estimated about 400 pounds. Likely very severe heart disease, diabetes. That's our single patient. We have a grand total between the ages of 30 and 39 of 28 people. By the way, this is not people who died of COVID. This is people who died with COVID. At their death, they tested positive. That's how it's being reported. 40 to 49, 123. 50 to 59, 387. When you get into the 60 to 69, we go up to 1,000. And then you can see that most of the deaths are here. We got the small count over here because not too many people live over 100. By the way, we were one of 5 states that mandated the nursing homes take sick patients into the hospital. All right? One of the ones that take sick patients into the hospital. If you look at this, almost every death is over the age of 70. Almost every one. Add this line, this line, this line. Why not throw in these 117? That in and of itself, that's 2,000, that's 4,000, 5,500. So out of a grand total, I think we had 7,000 deaths, 7,500 deaths, 5,000 of them were over 70. This is neat down here. If we look at the weekly report, the number one comorbidity is dementia. Followed closely hypertension, diabetes, COPD. And if I see one more fat person wearing a mask, I'll be like, you know what? Your diabetes is going to kill you way faster than COVID. But I want to take with this the framework. Oh, by the way, before we get into the framework, I do want to center in and look at our county because I think it's significant to look at Centre County. Okay, so here in Centre County, can I select Centre County? Can I not select Centre County? I thought I could select Centre County there. Oh, there it is. So if I go into my county, we have 365 confirmed cases. 45 of them are just probable. So 10% of our cases are just possibly cases. 11,000 negatives, a grand total of 11 deaths. Like I said, our local coroner's office only knows of 7 of them. And they range in age of 76 to 94 years of age. That is the framework that I'm going to show you what is going on in the town. So Patton Township, this is half in the woods. This is one of the townships surrounding State College. They have now approved an ordinance to enforce masking with $100 to $300 fines. The limit This is the ordinance. Mask coverings, both mouth and nose, are required inside any building open to the public, including stores, other businesses, medical facilities, and government buildings, on all public transportation and rideshare services, while waiting to enter a building. So you're standing out on the sidewalk waiting to enter a building. You have to wear a mask. While working a job that entails coming in contact with any member of the public unless separated by a physical barrier. And when in contact with anyone who is not from the same household or family, whether indoors or outdoors, including but not limited to contact during gatherings, curbside pickup, drive-through, food truck purchases, deliveries, and service calls. Parents are responsible for their masking their children under the age of 2. They are exempt at that age. And so the kid that I've mentored since he was 13 years old, that I see multiple times a week, since we don't live in the same household, we are henceforth now forbidden from going through Dairy Queen's drive-thru, going to the park outdoors, sitting at a picnic table alone, and talking like we've done for the last 5 years, 7 years, I don't know. $11 people died. Only 7 of those are confirmed by our county, all 76 years of age. This is nonsense. By the way, nearly every county, like every township around us, except mine, has adopted this. So all of the Penn State students come back. I think classes start on Monday. All the students are coming back. Large gathering was there. So now we have a whole group of 18 to 22-year-olds who are away from their parents' house. They come to school and they, by the way, were forced to sign a compact before coming. We're going to get to what they were forced to sign. And they're basically told, you have to mask perpetually. You're not allowed to have any parties. You're not allowed to have any friends. In fact, they've already suspended a fraternity for having a meet and greet party, welcome back to campus party. By the way, the fraternities, they're like giant apartment buildings. They're like mansion houses with apartment buildings downtown. I don't know how you can't fit 10 people in there. I mean, more than that. So the students basically did what students do, and they rebelled, and they had a giant non-socially distanced, non-mask party on front of Old Main Lawn, and the police had to come and bust it up, and then the sackless university president comes on down. After large gathering on campus, President Barron warns against unacceptable student behavior for a population that is not even impacted by this. This is what he says. Whole thing, and then of course we got all sorts of things. Oh, Michael Pipe, my favorite communist. He is one of the commissioners here. He was reaching out. University actions. Let's see. Board of Commissioners chairman, the communist Michael Pipe, wrote on Twitter that he was reaching out to the university about what actions will be taking, calling the disregard for masks and physical distancing completely unacceptable and disappointing. Conklin wrote, while we know the behavior is not reflective of the student body as a whole, it only takes a small flame to spark the whole wild in the context of a pandemic. It is simply not sustainable to risk overwhelming our local hospitals and healthcare workers. Oh my God, our local hospitals are overrunning with people. So much so, they laid off 250 people in our local hospital 2 months ago. Here's the compact that the students were forced to sign from Penn State. As we return to in-person experiences in our campus communities during the ongoing pandemic, we must acknowledge the responsibility we all share. I am really getting 1984 vibes here. Every member of our university community, including you, must strictly follow fundamental public health requirements and measures. By the way, there's signs all over campus. There's 2 signs. One of them says mask up or pack up. You're not wearing a mask, you're going home. We're going to send you home. The other one literally says, keep off of the benches, decorations, wall things, anything to keep a sanitized environment. Why don't you just get big alcohol machines and rain booze down from the sky? That'll keep a sanitized environment. So they say our return is tenuous and could be brief. They're already laying bets as to when they're going to send everybody home. Its success depends on each one of us doing our parts. By the way, everywhere mask orders go into place, infections go up. Very interesting. Failure to abide by the following requirements may subject you to disciplinary action, including suspension or expulsion from the university. This is a document every student is forced to sign. You must be tested for coronavirus as directed by the university, including testing we may require prior to your arrival on campus and is necessary throughout the school year. Number 2, fully and candidly cooperate in contact tracing. By the way, this university is requiring people to use a contact tracing app, which requires you to keep Bluetooth and location services turned on your phone. Turn them on your phone. Required to. You don't do it, you're expelled. The app already has 2 known security risks. It is leaking data to an analytics firm, and the health services on the university knows exactly who you are and everybody you've been in contact with. That's what they're forcing people to do. Now, Penn State does not have that particular app in place yet, but you can be sure it's coming because the confused science director who doesn't know what an X and a Y chromosome is in our state has already said, hey, in 1 month, we are going to have an app. And with the communist dictators that we have running Pennsylvania right now, with the werewolf of Harrisburg and his hunchback confused person, they are going to mandate that in some levels, I promise you. Because they're crazy and they've lost control, and they've already been voted out in both houses in Pennsylvania, and they just refuse to comply. So the university wants full and candid cooperation with contact tracing when called upon to do so by the university. That's what they want. If you test positive and must isolate or are identified as close contact with someone who is infected, you must self-quarantine. Explicitly follow university's instruction, which, by the way, they cleared out one entire residence hall, and it's the quarantine zone. So if you test positive or have been in close contact with somebody who tests positive, how long before everybody is locked in there as a prison and we have the Penn State prison camp? I'm sorry, guys. You got to drive 3 miles down the road to get to the state pen. This is Penn State. Wear face coverings in campus buildings at all times, outdoors when you cannot social distance from others, and wherever state and local laws require, which is basically everywhere. Honor the physical distancing requirements established in classrooms and other campus locations and all gatherings on campus, so do so in any other context off campus that requires distancing. So you have to agree to social distance and wear your mask when you're not even on campus. Gotcha. Follow guidance from university and other authorities, including signage, postings, emails, and notifications, which, by the way, all downtown there's these little stands here, stand here, stand here. Watch some of Dave Collins' stuff lately. It looks like that downtown State College. Maybe I'll take my camera down and snap some photos, but, we'll see if I can do that. Other important guidance follow. This is where it gets interesting. Self-quarantine for at least 7 days prior to coming on campus. If you test positive at a location away from campus, including in a different state, immediately contact the university to let us know. Get a look at load of this one. Get a flu vaccine as soon as the vaccine is available. I'm sorry, I thought we were mitigating COVID-19. What's the flu have to do with it? You told us the whole time this has nothing to do with the flu. Now you want to mandate a flu vaccine for your COVID compact. Scrupulously follow good hand hygiene practices. Whenever you're feeling ill, stay home and seek medical care. Yeah. So, do you stay home or do you seek medical care? I promise you, you seek medical care, you're going to be locked up in Penn State's State Pen, aka East Halls. Rigorously restrict your travel to only travel that is necessary. Guys, this is 1984. I'm reading the book right now again. You can be here this time. Don't travel anywhere else. Consider walking or biking rather than public transportation. I'm not going to read all of this. You can go ahead and read that. The links are in the description. I'm going to skip the next story I was going to do. This is a little heavy, so I'm going to get in on a couple little fun things. First, if you're like, holy crap, where's this possibly going? I actually wrote a little book, and it is free. You can go right on to the site and download it. worldwarepress.com. Again, link in the description down here. You can read the first section right here. And it's a short little book. It's probably about an hour or so to read at most. You can actually download it. And I am making this freely distributed. There's no payment involved. There's no data collection involved. Just click on this button here. It's a zip file. It's going to contain a PDF and an ebook file. I think it has an EPUB and a Mobi file, so you can send it to your Kindle device. Go ahead and read Lockdown. I had a really fun time writing this when the original lockdowns were on. So go ahead and read this. But I want to show you some things where we are potentially close to becoming. First and foremost, up in Maine, the governor says that servers must wear face shields upside down so that their breath is directed up and not down. In other words, yes, the governor of Maine would like you to wear the cone of shame if you are in Maine. So, welcome, cone of shame users. This was neat. This was posted by Dave Cullen over there on Computing Forever. Of course, this is what a COVID isolation thing, so some outdoor thing. So basically each family unit gets to have its own little pen. It looks, looks very similar to this guy down here. So, so everyone, when these restrictions are here, I want you to practice this. Practice going, and do that as you're walking around following the signs. And when people are like, what are you doing? So they're treating us like sheep. I'm just going to go. All right. And so this is what is happening. So back to our question. Where is your line? Are you going to participate in this society? Are you going to wear a mask? Did you know that there are now 3? There was one at the start of this, one study that said, hey, don't wear masks. The mask group had more infections than the control group. That study was done in 2005, I think. Since then, we got a study out of Holland and a study just reported last week from Duke University. All of them said, don't wear a mask. We're running around wearing masks. It's to silence us. It's to change us. Do you want your children to end up looking like this? Because they will. This is what they want. Isolation chambers. Your children cannot go to school like this. If they are doing this to your kids, you pull those children out of there and you educate them yourself. Because you may be like, I just don't know if I can be a teacher. I got news for you. If this is what they're doing to your kids, a baboon can teach your children better than these school districts. Don't let this happen to your children. When the people fear their government, there is tyranny. When the government fears its people, there is liberty, from Thomas Jefferson. All right, guys. So here's the thing, right? We have been sold a bunch of fear from the media. Fox News, CNN, NBC, ABC, every one of these main media centers, every one of them, they're pushing fear. I can't tell if they're pushing fear to push an agenda or if they're just pushing fear to get clicks and ads. I can't tell you. I have no idea. I can't tell if it's intentionally nefarious or if it's just blind greed. I don't know. But the fact of the matter is we need to take a stand. Now, there is somebody in Columbus, Ohio, who is actually taking a stand. This is Pam Popper. She has a YouTube channel, and she is going through all of this type of data, and she is working on a group called Make Americans Free Again. So makeamericans.freeagain.com. And what she is doing is she is collecting stories, she is collecting policies, she is collecting lawyers, and she is getting ready to file a lot of lawsuits against various governors on state, local, and federal levels. She also has information for homeschooling. So if they're putting your children inside of this crap, you head on over to her website at makeamericansfreeagain.com and go on to homeschooling, and they will have a lot of information here. She, by the way, is recommending if you're a college student, take a gap year. Take a gap year. Don't agree to these compacts that deprive you of your rights and deprive you of your humanity and deprive you of your individuality. Okay? Stop fearing your government. Take a stand, make your government fear you for a little bit. She has a lot of resources over here to help out with that. So she is collecting information. You can actually go over and fill out the information there if you need help with any of these types of things. If you're needing any of those types of services, definitely check out what she's doing over there, because we have the ability to take a stand to not fall into total dystopia. But we've got to take the stands. I'm taking the stands locally by raising awareness, by doing these videos. And you know what? If they don't want me going through Dairy Queen without a mask, sorry, Dairy Queen, you just don't get my business anymore. Sorry. Because every business has cucked up and decided to just roll over and bend over to what these guys say. The unconstitutional mask orders that they want to fine us for failing to wear something that's on our face that's actually going to cause more harm than good. That's the reality, guys. We have to get back to the point where the government fears our uprising. Stop fearing your government and stop letting the news tell you to be afraid. When you see all these articles, oh my God, they're not masking, they're not social distancing, oh my God, oh my God, oh my God, it's unacceptable student behavior. You have college students not wearing masks and not socially distancing, having fun on Old Main Lawn. We've let them give us fear. Turn it around, people. Turn it around. Have a look again at Lockdown. You might enjoy it. It's a long video. We're going to wrap up here. Thanks for listening, guys. We'll see you next time. Thank you for watching this video from Switched to Linux. This channel would not be possible without the backing of the program supporters scrolling on the screen now. You can be a supporter at Patreon at patreon.com/TOMM or at thinklifemedia.com. I also want to thank the open source community who creates such excellent software that makes producing this show possible. Please remember to support your software communities. Thank you, and I hope that you enjoy switching to Linux.